Sculptra is an injectable poly-L-lactic acid. It's not a filler, it's an injectable biostimulant. It's something that once it's injected underneath the surface of the skin, stimulates production of your body's own natural collagen over time. So it's something that will give a gradual, subtle, natural result. So the question of who is a good candidate for Sculptra, and there's kind of a joke in our office that there's no such thing as a bad candidate, because for all ages, Sculptra is appropriate. It's just appropriate in different quantities. So my favorite patient is always somebody in their 20s and 30s who has the earliest volume loss, because the tiniest amounts of Sculptra will give us a gradual, subtle, but important improvement in that area, and also helps to prevent the changes going forward. So that's a really good maintenance or preventative medication for somebody in their 20s. And the same thing goes up. As we have more volume loss, as we get older, more amounts of Sculptra might be needed, but it's still appropriate for every age that we're starting to see age-related changes. It's not only for aging though. There are some patients who come in and they have smaller cheekbones than they wish they had, or they wish their jawline was a little stronger. So we can also use Sculptra to enhance those areas as well. It's kind of an exciting time with Sculptra, because now that we understand so well how to use it safely for the face, we are using it in many off-label areas on the rest of the body. So in my practice, plenty of my patients who have a crepey neck, we do just tiny bits of Sculptra, and that stimulates that collagen production and helps to improve the skin texture. A lot of the patients also see crepiness in their arms or their knees, and we know that crepiness is due to collagen loss. So again, small amounts of Sculptra there can help enhance that. And of course, one of the more popular uses of Sculptra nowadays is to enhance the butt region. So we use Sculptra frequently to help give augmentation for people's behinds. Sculptra is not something you're going to find in most med-spas and actually in many doctors' offices. It's something that requires specialized training and lots of experience in order to be consistent with results and to have safe outcomes. So when you're looking for a Sculptra provider, you want somebody who has lots of experience, who has been through thorough training, and somebody who really understands the anatomy of the area that they're treating. And I tell everybody, you want to see before and after photos and make sure that the idea of the outcome is similar to what you're looking for. You want somebody who shares your aesthetic ideal, and experience helps. I've been a trainer for Sculptra for 10 years. For me, Sculptra is what I do all day long. It's good to go to somebody who does that technique all day long. That's how you perfect things.